Now, Anambra State government is currently training community health extension workers and nurses on modified life-saving skills in Oka. The exercise, which will be in 3 batches, drew participants from the 21 local government areas of the state, while a reasonable number of the participants came from flood-prone local government areas. ABS Health correspondent Chibuzo Okoye has details of that report.
Training for the first batch commenced on 2nd July and will end on the 16th July 2023, while second batch will commence from 16th July and terminates on the 28th July. And the third batch, which will be the training of the trainers, will commence later. Addressing the participants, the Anambra State Commissioner for Health, Dr. Afumo Obidike, who said that Governor Chukwuma Soludo is very passionate about the improvement of the state's healthcare system, described the training as very crucial and strategic to the Anambra State government, as it wants to reduce maternal mortality to the lowest level. Dr. Obidike, who urged the participants to take the training seriously, noted that the state has enough manpower to even eliminate the maternal mortality and appealed to the trainees to learn everything they could, including how to manage high-risk pregnancies, such as a sickle cell carrier that is pregnant, among others, even as he commended development partners like United Nations Children's Fund and World Health Organization for supporting the state.
If we're able to learn it to the extent that we're able to teach, because that's what important.
One of the trainers, who is a professor of reproductive health from the Nnamdi Azikiwe University, Oka, Professor Brian Adema, said that the training is to teach all categories of health workers, otherwise called skilled birth attendants, on what they need to know as regards their jobs, as well as build their capacity for them to be able to refer cases that they cannot handle, and commended the Anambra State government for prioritizing capacity building in its health system to have improved healthcare delivery.
If you don't have competent workers working in those hospitals, the hospital is as good as useless. So what the Anambra State government is doing now is very commendable, because it is drawing the staff, the health workers, the nurses, to give them what we call a refresher update training.
The Anambra State Reproductive Health Coordinator, Dr. Uju Okoye, told the ABS part of Mrs. Nonye Soludo's 3-year strategic initiative in eradicating maternal and neonatal mortality in the state, and revealed that maternal mortality rate in the state is 281 deaths per 100,000 beds, which is one of the lowest, as the rate at the national level is 512 deaths per 100,000 beds.
We intend to reduce maternal and infant mortality with this training. Basically, empowering the healthcare workers on the skills that are needed in the health facilities. Their clinical skills will be upgraded, and this will help in reducing maternal and neonatal deaths in Anambra State.
One of the participants, Mrs. Joy Azubike, who is a community health officer, assured that she will use the knowledge garnered at the event to improve her skills and equally transfer the skills to her colleagues. Practical display of knowledge garnered by the participants during technical session formed the highlights of the training. In Oka, this is Chibuzo Okoye for ABS News.